let's turn our attention to our special focus on the year 2017. Tonight, our spotlight falls on the health sector. For the first time in several years, there seems to be some encouraging news from doctors and health workers at the end of 2017. Our correspondent, Mary Alale Yusuf, takes us through major events in the sector.
The first national scare occurred when a little boy came up with what was assumed by many to be poliomyelitis in Cross River State, South Nigeria. Bad news in the light of Nigeria's efforts to achieve polio-free status. It turned out to be a case of club feet, which was promptly treated. Protests for better welfare packages and facilities started in January, with resident doctors in Jos Teaching Hospital, Plateau State. In February, the National Body of Nurses and members of the Joint Health Sector Unions, JOHESU, according to the different geopolitical zones, took to the streets with an added demand for an end to discriminatory promotions. These were all peaceful protests, but by the end of May, tempers had flared. Resident doctors protested a move to throw them out of the secretariat they'd occupied, probably for decades. It resulted in a clash and several injuries. They kept the offices. September saw a national resident doctor strike. In the same month, the Joint Health Sector Unions took their turn. The federal government was on its toes, conducting meeting after meeting to soothe ruffled feathers of the various parties. They seem to have come to an understanding.
God bless. Thank you.
By and large, skipping had been implemented in almost all institutions in Nigeria, and that has brought a lot of peace, in health institutions between doctors and government.
It wasn't until when there was a threat, another threat to resume the suspended strike, that the Federal Ministry of Health finally moved the relevant documents to the presidency, which is a disaster, if you ask me.
All workers in the health sector are hopeful that the circulars will be obeyed and other demands worked on. There was a sizable outbreak of meningitis in several northwestern states early in the year, of the less frequently occurring serogroup C, for which some vaccines were obtained from the World Health Organization. This continued for several months with episodes of Lassa fever in some states, cholera, a case of yellow fever in Kwara State, a strange illness in Kogi State, and monkeypox, which started in Bayelsa State. All these were given attention with the aim of bringing them under control. Lessons learned from these occurrences are the need for constant vigilance, hygiene, and the use of necessary vaccines. Concepts which can be taught and grasped at the community level, where primary health care seems to be getting more attention in some states around the country. Mary Alale Yusuf, Channels Television News.
To discuss more about this and other matters in the health sector in 2017, we're being joined on the News at 10 by the Minister of Health, Professor Isaac Adewale. Compliments of the season, Prof, and welcome to the News at 10.
Thank you, Melinda. Compliments of the season to you too.
Thank you. Now, there's been a lot of agitations in the health sector in 2017, as always, so much to do about salaries and also about the workplace. What is your ministry doing to address these issues?
Well, thank you so much. It is an ongoing process, and I want to assure you that we are quite on top of the situation. We've also received tremendous support from the Ministry of Labour and Employment in trying to work together and ensure that we implement effectively government policies and circulars. We've also cautioned that no one in the health sector should issue out a circular without due approval. So I think working together will also help us to address this. We've also keyed it into the Economic Recovery and Growth Plan of government. You know, there are three pillars for this. One is to restore growth. The second is to invest in our people. And the third one is to build a resilient economy. I think investing in our people is quite critical. The World Bank has recently come out with a program of investing in our people. And according to them, there could be no way to restore hope and sanity to any sector without investing in the people. So in the health sector, we've made investing in our people a key program, and we are quite committed to this. We've also received tremendous backing from Mr. President, who actually directed that all those circulars should be implemented without delay.
Now, the sector was tested in 2017 with the outbreak of several diseases like monkeypox. A lot of Nigerians had not didn't even know that that existed. Well, we saw it come up in 2017. We had Lassa fever, meningitis.
We have measles.
Yes. So far, you guys did well with that. But how ready is the ministry just in case of any other outbreak?
I think we are better prepared to handle these public health emergencies. We know quite well that all over the world, emergencies will occur. What we do not know is when, where, and what. For us in the health sector, what we've done is to prepare ahead. Some of these outbreaks are seasonal. We know that as we approach the dry season, we will have measles outbreak, we will have meningitis, and so we are quite prepared. What we've done is to commence a program of nationwide immunization against measles. And I'm quite happy that the federal government, through the directive of Mr. President, approved 3.5 billion for the commencement of this initiative. So we've commenced nationwide screening, immunization against measles. We have continued with our effort to keep polio in check. We've also brought forward the campaign against yellow fever. You made mention of a strange illness in Kogi. It was yellow fever. Okay. We have outbreaks of yellow fever in Kwara, in Kogi, and Zamfara. And what we've done is to fast forward the immunization process. I've also spoken to the executive secretary, the CEO of Gavi, that is the Global Alliance for Vaccine and Immunization, about the need to support Nigeria. These vaccines are not easy to come by, but I've been reassured by the chief executive that Nigeria will receive tremendous support in 2018. So we're also fast forwarding the process. Our plan actually originally was to vaccinate the entire country over a 7-year period. We thought that would rather be too prolonged. So we're thinking about 4 to 5 years, and we'll receive assurances. Well, we started in Kogi, we started in Kwara, and we've also started in Zamfara. And we are quite appreciative of the support of the state governments. The governor in Kwara, in Kogi, they've been very supportive.
Now, before this time, we've been talking so much about revitalizing primary health care centers, and they are the closest to the people.
Oh, certainly.
But most of them are not even up to par. What is your ministry doing?
Well, we actually did an audit. There are about 30,000 PSCs in this country. But as of the time we did the audit, at the end of 2015, only about 20% are functional. And that's how we came about with the concept of revitalizing the PSCs. And our concept of revitalization is not putting up new structure. Okay. A building is not synonymous with the health center. So what we plan to do is to put life into these facilities, and we're starting with about say 10,000 of the 30,000. If we could have that across the country, we will have done well for our people. We are also partnering with the states, we're partnering with the local government, and we're partnering with the international partners. World Bank is supporting us, EU is supporting us, DFID is supporting us in revitalizing the PSCs, and federal government is also actively involved. But what has gladdened my heart most is the support we're getting from the states. The states are now waking up, and that's quite reassuring, recognizing the need to invest in the people. About 80% of ailments can be taken care of at the PSC level.
Finally, Prof, before I let you go, what about the brain drain that a lot of people talk about in the health sector?
Well, brain drain is not peculiar to Nigeria.
It's not.
It's an international event. People do so for quite a variety of reasons. Americans go to Thailand, they go to Malaysia to receive cheaper care. And so brain drain is not something strange. But what we want to do in Nigeria is to prevent preventable drains. Okay. And that is by beefing up and strengthening the tertiary health institution. In 2017 and 2018, our federal government has developed a program of strategic intervention in the health sector, and we are picking 8 of our tertiary institutions for intervention. 1 from each geopolitical zone, Lagos and Abuja for strategic reasons. And we're partnering, working with the Nigerian Sovereign Wealth Investment Authority. And we've also started, we are key into 3 major programs. we are key into cancer management, cardiac management, and renal. Maiduguri is the only odd one that is also keen into trauma, but that's understandable. The Boko Haram insurgency and crisis in the Northeast has created the need to develop a robust program to address trauma challenges. And so Maiduguri will do cancer and trauma, Ibadan will do cancer and cardiac, and so on and on across the country, we're getting this done.
Thank you so much. Professor Isaac Adewale is the Minister of Health. He has been speaking with us on 2017 and looking at the health sector.
Thank you.